Welcome back, everyone. As we wrap up our coverage of Black maternal deaths, this is an everyone problem. In general, more women are dying of maternal causes in the U.S. every single year. According to the CDC, more than 1,200 died of maternal cases in 2021, compared to 861 in 2020, even fewer in 2019, 754. So I wanted to explore some of the things that we can control, or at least understand, to stay healthy and alive while pregnant. Joining me now, we have Dr. LaRae Brown, the medical director for UF Health Women's Specialist North. Thanks for coming in. And it's interesting, we had a conversation in a taped interview, and then when I looked through it, I was like, I think this will be better to really just kind of dig deep into this so people can understand. So let's first talk about something called toxic stress. Why is that different than just regular stress?
Perfect. Thank you again for having me. But there's a continuum of stress. So I try to put it in 3 different buckets. One is positive stress. And an example would be, getting your kids ready for school in the morning. Everybody's a little bit heightened, but we have that extra push behind us to get our goal accomplished. The second bucket would be tolerable stress. So sometimes there are life events that are unexpected or unplanned that are extremely stressful, but we have enough mitigating factors around us to balance that out, such as the death of a loved one or unexpected bill or financial distress. And then there's toxic stress. So we characterize toxic stress as a chronic, unrelenting source of oppression, essentially, that can affect you the long term. So despite having all of the protective factors and being resilient, chronic stress is a chronic, unrelenting stressor on
Yeah, every day, you're waking up to it. And we talked and we said, that could be living in a neighborhood with high crime. And every day you see police, you see crime tape, and it's just hitting you. So give us some other examples of what is toxic stress.
Yeah, so it can also be, the neighborhood that you live in and a food desert, not being able to have access to healthy food. Continual worry about some of the things that we hear in the media or on the news and how that impacts your family or you as an individual. Also, it can get very granular with your interactions that you have on a daily basis. Systemic racism, and that is a very pervasive thing, and it can span the scope of our interactions with healthcare providers. It can span the scope of, as you mentioned, our interactions with law enforcement, our interactions our kids have in school. So if there is a continual heightened sense of alert and awareness regarding the potential danger or stress associated with those things, we can have biological responses to that chronically elevated level of stress and stimulation.
And how does that affect women when they're pregnant?
Definitely. So as we know, pregnancy is a very vulnerable time in the health of women and their unborn children. So a lifetime of chronic stress, and then you add on a pregnancy, can only exacerbate any underlying issues that may or may not would have developed. So chronic stress impacts every single body system. Your cardiovascular system is more elevated because you're essentially in a fight or flight situation all the time. Mm-hmm. So you can be more predisposed to some of the issues that you've talked about over the last several days: high blood pressure, preeclampsia, and some of the complications that can happen with delivery and the after effects on the fetus and the child as they grow and develop. Also, if you're entering pregnancy at a state where you have been chronically stressed, as you mentioned, the disparities between white women and black women, if you're coming into pregnancy at the same chronological age, your body may have weathered and aged faster. So that vulnerable time of pregnancy, we can see a lot of those underlying predisposing diseases appear and put you at higher risk for serious complications.
And you talked about weathering. I mean, I think we're in a place now where everyone's trying to prove that, that my life is hard or I've been exposed to racism, but there are actual markers that doctors can track in the body to show that you have toxic stress and the effects that it has on your health.
Definitely. Dr. Arlene Geronimus coined the term weathering to kind of represent that chronic wear and tear of systemic racism and political marginalization and just a lot of social issues and social determinants of health that can predispose you to these biological and physiological changes. And now the scientific term is called allostatic load. So we can actually measure cortisol levels and other biomarkers that can really tell us information and give us an objective objective way to classify patients and let us know who may be at higher risk.
Yeah, Dr. Brown, thank you so much. You know, I want to point out why we did this whole series is to educate people, because we know, again, we can't legislate our way out of this. You know, some of the protocols need to change for the medical industry, according to doctors, in order to really protect all women. But I do want to point out, Northeast Florida Healthy Start Coalition, every woman who gets pregnant, they're given a questionnaire, asked some questions, and to be honest about those questions. You know, some of them are like, do you feel safe? Right. You know, do you have transportation? Can you pay your bills? And some of those things could hint that you have this toxic stress, and then your doctor will be at a heightened alert to keep you safe while you're pregnant.
Definitely. The Healthy Start Coalition is a great organization, and it's a statutory requirement that at the beginning of every single pregnancy that initiates in the state of Florida, that they fill out a Healthy Start screen. No matter where you are along the spectrum of wealth or education, there are all issues that the Healthy Start Coalition has a lot of referring agencies and a lot of resources to help make pregnancies healthier. So like you said, being completely honest and open and allowing, you know, those resources to really aid the health of your pregnancy is ideal.
All right, thank you so much. So we're going to make sure all this information ends up on our News4JAX website. All of the stories you can watch, you can share with your family members, and also we'll provide that link to Healthy Start just in case you want, because they will work with you now, even before you consider pregnancy. There's the Magnolia Project for that as well. Thank you for coming in and making that so clear for our viewers this morning.
No problem. Thank you.